is the state of rural healthcare right now in this area?
Yeah, I think it's incredibly vulnerable, not just here, but all over the state and really all over the nation. Just, rural healthcare already was operating on a very fine margin. If any kind of profit margin, it was very fine. And given just the state of the economy right now with growing inflation, everything costs more, and especially staff. We saw a big change in the cost of staff going through the pandemic, and coming out of it, just people are demanding much higher pay rates. And so the more our workforce cost and the more our supplies cost, it's just taken a big hit on us financially. Unfortunately, we've not seen the reimbursement go in the same direction. Instead, we're getting a lot of pressure legislatively from employers and even from our patients wanting the price of healthcare to go down. And while we would all love to see the price of healthcare go down, it's the cost of doing healthcare, of providing healthcare, is going up. And so those two things have to go in the same direction, or else you get a really big imbalance. And right now we're seeing both of those go kind of the opposite directions, which is causing healthcare to become more and more vulnerable. Rural hospitals can't sustain that very long. Even other hospitals can't sustain increasing cost and reducing or decreasing reimbursement. It just doesn't work very long. So we're heading into a very unsustainable situation if things don't start balancing out.
A lot of your patients are Medicaid patients, and the payouts coming back are not what they should be. Explain that situation.
Yeah, so it's Medicare and Medicaid is one of our big populations here in rural communities, and the Medicaid rates in Indiana have not been adjusted in almost 30 years. And so if you're taking the prices 30 years ago compared to the prices today, it does not match. And so we really do need to see some sort of change in the reimbursement for Medicaid in order for it to be current and modern with just the cost of doing business today.
But the hospitals are just one part of the equation that estimates the cost of care, right?
Right, absolutely. I mean, if you take any kind of business owner, whether you're a farmer or you have a small business or anything, it's the cost of the products that you have to purchase in order to do business. They impact the cost that you're going to pass on to the consumer. Healthcare is the same thing, except we don't get to decide the cost that gets passed on to the consumer. In some ways, people think we do because we do some rate adjustments, and there's the number that comes on your bill that is what we have charged. But we are at the mercy of the federal government, state government, and then the insurance payers to determine what amount we get back. And we do have the ability to negotiate contracts with commercial payers, but many of those groups we're very small in the whole big picture. We don't have a lot of ability to negotiate the rates. It's kind of, here's your rate, here's what you're going to get. So if you can imagine that you're a small business, everything that you need to do business with, all of your supplies have cost more, significantly more, 40% more, but yet the consumer says to you, I'm not going to pay anymore. I'm going to pay you $10. And even if it costs you $20 to make that product, I'm still only going to pay you $10 for it. Most businesses would just say, I'm not going to do business with you, or they would go out of business. But in healthcare, you don't get that choice. You say, okay, and it would be illegal to not do business. So you have to take care of people, and that's what we keep doing. We keep taking care of people and fighting the good fight, I guess you would say. But we really do. There needs to be some sort of balancing out of all of this in order to stabilize the economy of rural healthcare. Yeah, there are people in this community today that are alive because we are here. If this hospital were not here and we're not as close to their home as we are, I don't think they'd be here today. And so really, truly, the decisions that are being made, they are life or death sorts of decisions. And it does sound incredibly dramatic when you put it that way, but that's where it's at. That's the reality of the situation. When you have a hospital close by, it can save lives. If the hospital's not here, it's difficult.